Hello, I'm Dr. Barbara Udell, and I travel all over the world teaching people to be healthier, to be more confident, and to have a better lifestyle. And I do it with humor, with knowledge, and I do it also with take-home techniques, things that you can use long after we have had our encounter together. Here's some of the subjects I speak on: stress, burnout, communication skills, anger, retirement, aging successfully, sleep, and the big one, love and intimacy. I have a doctorate degree in behavioral health education and a master's in social work. I was the former director of lifestyle education at the exclusive Pritikin Longevity Center. I speak to and with bankers, insurance companies, law firms, charitable organizations, weight management companies, and colleges and universities, and yes, again, all over the world. I'm what you would refer to as a change agent, and I can help you make a positive lifestyle change. I've also practiced family and individual counseling. And I've been featured on many TV and radio shows. But I also wrote a book, Hats Off, Living Life Full to the Brim. Now here are some of the words that I live by, and I'm hoping you'll learn to live by them too. Learn to be healthfully selfish. What do I mean? It means to be first for yourself. Learn to be healthy, to be confident, to be strong, because when you do, then you're going to be able to give all that you can give to the people that you care and love about, your family, in your workplace, and in the community. And if you're not able to do that, then you're not going to be able to be strong and confident for those people that you really care about. So you take care of yourself first. Now, on a personal note, I have lived a life of great joy and of adversity. But as a German philosopher, Friedrich Nietzsche, once said, that which will not destroy you will make you stronger. I am married. My husband is Barton Udell. He's an international tax and real estate attorney. And between us, we have 5 children and 11 grandchildren. And they live all over the United States. We live here in Miami, Florida. Well, here are some of the highlights. I hope that you'll enjoy them. This is what I do. Let's talk about the definition of it. It's the transmission of information. That's sort of it. It's the transmission of information. Now, how do we do it? We do it through gestures. We do it through the tone of our voice. We do it for using particular specific wording, and we can do it through music, and we can do it through dance. I want to pause here about the dance. You know, I always work in exercise. You didn't think today would be any different, did you? I'm thinking sometimes you want to give a gift. The holidays are coming. Give someone dance lessons. And it is so wonderful, and it helps you with your brain, it helps you with your circulation, and you'll have fun doing it. So a lot of you say, well, I'm not dancing, I don't dance because you got to really be in good shape. No, you don't. In fact, do you know in nursing homes where people are confined to their chairs, they do something called chair dancing. They will teach them to move, and the music will play, and it's very exciting to see people that are chair bound listening to the music and doing, you know, whatever movement they can. This is not to be confused with lap dancing. There's something called stinkin' thinkin'. It was coined by Zig Ziglar. And there are certain things that we talk to ourselves and put in our heads that really make for difficult communicating. The first one is catastrophizing. Some of us we'll look at a situation and we will blow it out of proportion. We will get upset. We will have heart palpitations. We will get very scared and nauseous. Example, you say to the kid, I want you in at 11 o'clock. It's now midnight. Where's the kid? Meanwhile, your partner, spouse, whatever, wake up. How can you sleep? He's not home. Look at what time it is. It's 12 and you told him and you threatened him and he's not here. All right. Well. What kind of parent are you that you can? Where do you think the kid is in this person who catastrophized? The kid obviously is what? Oh, yeah, dead. Somewhere, they don't know who he is. They don't know what to do for him. It's a terrible thing. We think all kinds of awful things. We catastrophize. If someone is late, if someone doesn't call or they forget to call, whatever. Meantime, the kid comes home. He says, well, I'm really sorry. What do you mean you're sorry? I've been up all night. I'm hysterical. Where have you been? He said, well, if you would buy me my own car, I wouldn't have to wait for a ride. Right? Or they go, but you had a cell phone. Why didn't you call? My battery went dead. Please, they have a million excuses, right? Meantime, the kid goes to sleep. Yeah, he'd been out partying. You think you stay up and then fall asleep right away? No. The whole thing about catastrophizing is it is a stress response that we do all by ourselves. Catastrophizing. Next one would be jumping to conclusions. I love this one the best because it really happened to me. I'm doing a room full of 400 women. How do I know? They all paid to get in, and they told me. And I've got them on the edges of their seats. And I was younger then. I was lovelier. I was taller then. And, oh, my, I had them, except for 2 women sitting in the back who kept talking during my whole talk. They were the only ones. So, of course, I'm finished the talk, I get a standing ovation, and I don't care. I march myself back. I stand in front of the 2 women. I go, could you just tell me what was so important that you 2 never shut your mouths during my talk? And the one woman looks at me and she said, yes. She said, my friend doesn't speak any English. She said, I was translating every word you said, and we love you. True story. Okay, so decision-making skills when we communicate with each other and we want to get information. You ready? Here's how it sounds. Do you want to go out to eat tonight? Yes. Where do you want to go? I don't care. You really don't care? I really don't care. Okay, good. Let's go for Italian food. Italian food? Every night this week we've had Italian food. What's with you with the garlic and the smell and all the oil? Why are we, what are you with the, you said you didn't care. Well, I don't care, but I never thought that you would pick. Never give away your decision-making privilege. Never give it away. If you really don't care, then you better keep quiet when the other person mentions a movie or a restaurant or anything else, because it will come back to get you. Well, there's something called PVCs, paraphrase. Most of us know how to talk, but a lot of us, we don't know how to listen, or we don't know when to listen and how intently to listen. Paraphrasing, if you were ever in therapy, the therapist would say to you, I hear what you're saying. Or they would say, if you said something like, I feel very lonely and I'm disturbed about it. And the therapist will say to you, so I'm hearing that you feel very disturbed, you feel very lonely. Do you hear what they're doing? They're paraphrasing. It's like parroting. They do it for 2 reasons, and we can do it too in our lives for 2 reasons, especially to somebody that doesn't think you ever listen to them. And they're always accusing it, you don't listen to me. Your friend would tell you and you would believe it and do it, but you don't listen to me. It's because when you give them back what they said and you paraphrase it, they know you are listening to them, because that's proof, and they get very happy about it, and they will want to continue to speak with you. They won't close down. If people think you're not listening to them, what do? They close down. That's like, I'm done. He, she, they're not listening to me. I'm not giving any more of myself. Paraphrase. Second would be validation. Sometimes we look for people to validate our feelings. Well, you know what? You can't really invalidate somebody's feelings unless you want to rescue them, unless you want to take some pain away from them. Example, I feel so fat. I just feel really dumpy and fat. You possibly want to say to them, to rescue them, you don't look so fat. I think you were fatter last year. But this year, I think you look thinner, and no, you're okay. The point is that person feels like that. How can you not validate it? And here's how you validate it. Oh, so you think you feel fat? You think you are a lot overweight? Got it? You may not believe it, but if that's their belief, you cannot take someone else's belief away. Do you like it when you tell somebody how you feel and they go, oh, you shouldn't feel that way? I mean, after all, he was a rat. You should be glad you got rid of him. You know, what do you care? So PVC so far. We got the P, paraphrase. We got the V, validate. Now we have the C, clarification. I love this one. Why? Because sometimes we snap very quickly when somebody will just say a phrase and we latch onto it and we think we know exactly what they mean. For instance, somebody comes into your office and they say, oh, I'm so exhausted. I am so tired this morning. And you go, you were upset again, weren't you, about him? I told you, get rid of him. I've told you a long time ago, you have no business being with that man. He said, what are you talking about? I was up all night watching movies. I'm exhausted from watching movies. So how can we deal with that? You might want to say this to people that talk to you, if in fact you're not too sure. And a lot of times we're not too sure. You ask them things like this. Could you be a little more specific? Or, hey, tell me something else about that. What else is happening? What else is going on? And ask some questions. Don't just jump right in there like thinking that you know exactly how they feel and what they mean. So try to remember active listening skills. P, V, C, paraphrasing, validation, and clarifications. Any questions? Welcome once more. Welcome to stress. And I do want to begin and end on time because I certainly don't want to stress you out. Are you wound tighter than a tick? How do you feel right now? And let's look at, what does stress really mean? What is the definition of it? Well, there was a man named Dr. Hans Siles, who we refer to as the father of stress, and he gave it a definition and did a lot of research on it and said it's the wear and tear on the mind and the body. And I would like to throw in also on the spirit, because when we are stressed out, our soul is touched also, and we are drained. So I just throw in my own for Dr. Siles. Why is it dangerous? It's chronic. It overworks all the organ systems, the systems that operate our bowels, our lungs, our heart. When this is done on an all-time continuous basis, which is what chronic means, what happens is they start to wear down, become diseased, become problematic, and stress can kill you. Well, let's see what causes it. What makes you stressed out? And we could probably do an audience participation, and we would find all different kinds of causes for you individually, because what is upsetting one person doesn't mean anything to another person. They just shrug their shoulders and go, what are you getting so excited about? So what? So your kid got divorced. So your dog died. Why? What's the big deal? But for each person, we deal with it in such an intimate, personal way. Well, There is something called a stress measurement form, whereas I would hand you a piece of paper with all these items listed, and next to each item, which are known as life events, I would give you a score. And you could add them all up, and in a year, when you get a certain amount of numbers, if some of these things have all happened to you in a year's period, you would see that you are at very high risk of becoming ill. So it's very important to keep your eye on what your lifestyle is doing in terms of life events. Illness. Now, why would illness give you so much stress? By the way, you get about 85 points for illness, I might throw in. First of all, just having to take care of an illness is very stressful. Making the doctor's appointments, showing up, getting the medication, not feeling well, fearful of what will happen if you can't resolve the illness. Finding out what your diagnosis is can be very frightening and upsetting. So illness, just by itself, it can create a big stress response. Certainly divorce. Divorce, you get 90 points. I personally think you should get 110, but I'm not in charge of the measurements. What is divorce? A sign of what? Yeah, a sign of failure. In fact, some people say, better, he should have died, and that would have been better than me getting a divorce. So, and death, by the way, could go right up there with it, because that's also the 90 to 100 points. So death can also be something that may never, ever stop stressing you out. I know people that have gone into depression from the loss of someone in their life, and they never, ever get over it. Do they function? Sort of. Not totally, not fully. And I'm not saying that if, in fact, you have someone in your life that dies, and it doesn't really matter who it is, because, again, this is very personal, whether it could be a friend, a neighbor, a child, a spouse. It doesn't matter. We all respond in different ways for different amounts of time. But here's where I get to tell my woodpecker story and take off my shoe. Are you ready? Here is the sound of the woodpecker. It's right outside your window. It drives you crazy. You open the window, you throw water on that bird. But what do you think? The bird comes back to the same tree again. Now you're wild. Your eyes are glazed over. You have a rapid heart rate. You get an axe and you chop down the tree. But what do you think? The woodpecker finds another tree. Here's the story of the woodpecker. Why are you getting so excited and upset and anxious about the woodpecker when the woodpecker is only doing what woodpeckers do? This is what they do. Why are you getting so excited when you're sitting in traffic and it's one car in front of another car not moving? Why are you laying on the horn, screaming at the person next to you, and sticking your arm out the window making obscene gestures? I see you. I know you do that. Because nothing is going to change, and the best we can do when we're in that kind of situation is deal with it in some other fashion. I know people that try to learn languages while they're driving, or they're listening to music or other kinds of CDs, or they'll sing and hum, but not to sit there and make yourself sick and crazy. That is the story of the woodpecker. People from all over the world, they call me and they say, Barb, we got the B, we got the L, nobody can remember the M. What was it? This is for people that walk around holding on to grudges and anger and pain and old stories and events. I would ask you to BLM. Back off, let it go, so you can move on. I am not asking you to forget. I am not asking you to forgive. I'm only saying get past it so that you can move on and have a healthier, better life. So I teach you the 6 quickies. These are 6 under 1 minute stress reducers. First, we're going to do them together. Are you ready? Lift up your shoulders to your ears to the count of 4. 1, 2, 3, 4, you do this about every hour, every 2 hours. It helps relieve some of the tension, as I said, that you carry in your neck and shoulders. The second one would be your eyes. Just simply close your eyes. They will allow you to remind yourself, you know what, I'm really getting uptight. I'm getting upset. What about your shoes? What's the first thing you take off anyway when you come home? You take off your shoes. If you're in the middle of some negotiation and the guys are yelling, what do you think? Those numbers are ridiculous. What do you think? We're stupid? Just kick off your shoes and wiggle your toes and remind yourself about how absurd all of life can be. Yawn. Put the hand in front of your mouth. That's the polite thing to do. And yawn has something to do with a TMJ, which is a tightening, and you can dislocate your jaw. If we have any dentists in the room, the technical name is also called bruxism, which is the grinding of the teeth and the chomping down on your teeth. Had a woman one time in my class, she was fitted with her 3rd mouthpiece. She bit down so hard, and some of us at night when we're sleeping, we don't even know we're doing it. What are we doing? We're grinding our teeth. When you yawn, you will be aware and you will feel if there's a soreness in your jaw. Unfortunately, this TMJ has to be dealt with on a surgical procedure. I'm hoping it doesn't come to that for you. Talk to yourself and ask yourself this question: is it worth dying for? And if the answer is yes, continue on, because that's what you're doing. You're killing yourself. If the answer is no, then you better kick in and find a way to handle it. And breathing. You inhale through the nose. You exhale through the mouth. This is known as Barbara's Big 10. You inhale through the nose. They don't know what you're doing. There's a person in front of you screaming and yelling at you. What do you normally usually do? You yell back, right? You're in a conference. No, not anymore. It's over. You inhale through the nose. You exhale through the mouth. These are very short breaths. You inhale. You do this for 10 times. At the end of your 10 breaths, you have brought down your heart rate and your blood pressure. We did this at Pritikin. We used to put the monitor on you before we did this exercise, and after this exercise you were able, without medicine, without any kind of contraption, with any other kind of person, to bring down your heart rate and your blood pressure. So there you have it, your 6 quickies. It's actually a learned behavior, anger. You have to learn it, get it, see it. Well, here's the effects of anger. This is part of my job, to talk about the correlation between CHD, which is coronary heart disease. When you have a stroke, these are some of the signs that you will notice. Numbness, trouble speaking, difficulty seeing, trouble walking. If you see someone that you are with, or perhaps a neighbor, or maybe you're at a party, these strokes can occur at any time, day or night. And you will see some of these symptoms. Get the person to try to talk to you and just say 2 words. Get them to raise their arms up and see if they're able to do that. There are certain things that you can do to check. But the main thing is get them medical help immediately, because when you have a stroke, the sooner you get medical care, the less residual effect you will have, because there are medications that can be administered immediately, and it'll make all the difference whether people can walk, whether they can use one side and not the other, and so forth and so on, but you have to do it quickly. Well, here's the characteristics of type A's. I'm sure there's no one in this audience who is a type A, but the truth is we all are, in some fashion. There may be 1 or 2 or 3 of these elements that are us. There may be very few of them. I don't know, but you can bet we have at some time exhibited. First of all, we want it done perfectly. And if you happen to be in a relationship with someone that wants it perfectly, they figure if they're perfect and they're trying all the time, why can't you be the same? Why can't you pick up the stuff when you're supposed to? Why can't you send off the letter in a time? I'm going to separate you two. I'm telling you, this is just a warning. I see she's giving him this, and he gives her back. You think I can't see, but I can see a little bit, like maybe the first 3, 4 rows. Well, what about us? What makes us angry? What will do it to us? Well, come with me to the grocery store. You ready? You only need 3 items, because after all, you're in a big hurry. So you go to the grocery, you get your 3 items, you got out your basket, you run up to the cashier, and someone's ahead of you. But don't worry, you're in the right line, because there's a big sign up there. It says under 10 items or less. Now, this person in front of you has 15 items. How do you know that? Yes, you did. You're standing there. You're not going to take this, and you don't have to. You go to the cashier. You say, excuse me, that person is in the wrong line, and you're checking them out. Don't do it. Stop. You see? I know. I'm in the right line. The cashier can't get that stuff out as fast as humanly possible. You know what to do. You've raised a family. You have a career. You started it from scratch. You built a company. You have to see the manager, the person in charge, right? Start at the top to get the results. I want to see the manager. Oh, they put the light on, and you think the manager is hanging out here for you. You're waiting. Meanwhile, the other person is being put through, bagged. Now they're getting bagged. You're getting a little nauseous. Your eyes are dilating. You're starting to get that little headachy feeling that we get when we get angry and stressed out. Here comes the manager, usually a man. He's usually wearing a white shirt and a tie. Looks at you, says the magical words, which I have taught him in anger management. The magic words, after you finish saying what you have to say, what to sign, and the person, you're even angry now with the cashier. She's no good. I don't know why you hired her. I'm so what? I'm so sorry. That's what you say. I'm so sorry. You bet he's sorry. He's sorry you were even born. You want sorry, he's really sorry. So, okay, now he's heard your whole story. Finally, you're getting checked out. The other person is in their car singing, I love you with all my heart. They're happy. You think they got a problem. No. You, however, does it go away when you go into an anger response? Just because the fear, the anger, the tragedy, whatever it is that you are facing, it doesn't go away. You still have the headache. You still have a sick feeling in your stomach. You still are shaking. It doesn't go away immediately. And if you're learning to deal with this anger and this stress, it's okay to be these things, but you better keep the balance going, and you better learn to be healthfully selfish. Any questions? We're good? We're good to go. Here's some solutions. I told you, it relieves stress and promotes cardiac health. What else do you want? You're blessed. You have the ability to put on a pair of shoes. Take a walk. Go on the deck. Walk around the ship. I don't care where you walk. Keep yourself safe. I know it snows, so you'll have hopefully a treadmill in your home if you have room for it. But exercise, journalize, keep track of when you get angry, how long you stayed angry, and what did you get angry about. Avoid it. There are certain things. Go a different way when you drive somewhere, when you know there's traffic, or certain places where there are bad drivers. Come on. Use a little common sense in trying to avoid some of the things that upset you. I love my 50%, don't you? You better believe this is what happens, and I'm very sorry I have to be the messenger of this, but don't expect people to always agree with you. They are just not going to. And I leave you with this. Holding on to anger and resentment is like taking poison and expecting the other person to drop dead. I wish you great success in this journey called life. Thank you again for being here, and I'll see you next time. Can you change other people? No. When will they change? When they what? When they want to. I don't know, any of you have grown children. You could threaten them. You could bribe them. You could do as much as you could to get them to change. They might for a while, but then they flip back when they want. Look, I'm not even going to talk about adult children. Did you ever try to feed a 2-year-old that didn't want to eat? And you get the applesauce on the spoon and you wedge it between them little teeth, and finally you get it in there, and what do they do with it? They spit it out at you. It ought to tell you, like, right away, this is not easy stuff. Well, you better do a reality check, and it's your serenity prayer. If you walk away with anything today, I would hope it would be this. Yes, I'm encouraging you to change. Yes, I hope you look at some positive things in your life to do. But could you know that it takes serenity, calmness, quiet, and hopefully today we're going to learn a visualization relaxation technique and accept the things you cannot change. I know you get angry. I know you get frustrated. I do. I see things that are happening in my family, in my country, in the world, but guess what? I had to learn. I even had to pay a therapist, but it only took one session. And she set me straight right away. And one of the things she said was, I have to accept it's not my life. It's hers. What a lesson you have to learn sometimes. And the courage to change the things that you can. It's so much easier not to do anything, isn't it? Even when you're suffering, even when you're in pain. I used to be a voc rehab counselor as a social worker, and sometimes we would take children out of homes that were abused physically and emotionally, and guess what? They wanted to go back where? They wanted to go back home, because that's what they knew, that's what they were used to, even though it was horrible, even though we put them in beautiful homes with people that cared for them and gave them and took care. So change is tough. Well, you better have that kind of courage, but here's the biggest of all. You better be smart enough, the wisdom, to know the difference. Well, I'm going to give you the models for change. How come you're not writing? You're going to buy the book, right? Self-awareness. Fritz Perls, who was a psychoanalyst, he says awareness cures. What's that mean? Work with me. Awareness cures. What? Yeah, if you already know it and you acknowledge it and you recognize it, now you have a beginning for change. If you stay in denial and you don't think about it and talk about it and feel for it, you are never going to make a change. Okay, practice. Oh, well, we got the T. Hold it. T. Take time out. There's time out in ball games. What do they call it? What? The seventh inning stretch. Okay. There is time out in theater. What do they call it? Intermission. Right. In my town, it's time to just go out and get a drink at the bar. I don't know what they're doing in your town, but all of a sudden they got bars during intermission. I thought you were just supposed to go to the bathroom. And when you're taking time pictures with a camera of perhaps a bud and you want to see it open, time release, it takes time. We need some time to ourselves to be quiet, to meditate, to think, to contemplate. Otherwise, you're never going to get to step one. Because if you don't give it some time, it isn't going to happen. Because we're always busy and our minds are going. Fake it till you make it. You better practice. That's what changing habits is about. You do it once, you do it twice. You remember as a kid when they taught you to ride a bike, you first got on a bike, what'd you do? You fell off. Well, then what'd you do? Got back on again. Then what happened? Yeah, you fell off again. Maybe you even hurt your knee or your elbow. And eventually, guess what? Maybe you were fortunate enough for someone to hold on to the back of the bike so you could get your balance and you started to ride. And for the rest of your life, you ride. Well, that's what change is about. You got to keep at it, be persistent. I told you it is difficult sometimes. It is not a good, comfortable, whoopee-doo feeling. That's not how change works. But eventually, you're going to ride. Now there are your loved ones, people that sometimes interfere in what you're trying to do, and they love you. What's going on about that? Oh, sweetheart, just eat this piece of key lime pie. I grew the key limes myself, and it can't hurt you. Well, I'm diabetic. I know, but one bite, one piece of pie ain't going to do it. And then you're in some kind of coma. But And I love you. I loved him so much. So beware of the people that could sabotage you. People do not applaud you when you start to make a positive change in your life. Can you imagine that? Because you're rocking their boat and they may not be doing it. So like now they're watching you do it. No. Barriers. Staying on track. This is like your New Year's Eve resolution. Every year we have a resolution. This is what we're going to do. This is what we're going to change. You know what? As you're going through this change, things happen. Cruise control. You know when you're driving, right? You're fine. You're going along while you're making this change. You're doing fine. You're doing great. And all of a sudden, a car swings in front of you. You slam on the brakes. What happens to cruise control? It stops, it goes off. That's okay, because all you have to do when that happens to you in life is, because it may be illness, it may be an accident, it may be a relative coming to visit. I'm in Florida, everybody's coming to visit. And whatever it is, it stops you from doing what you need to do when you're doing your model for change. It's okay. You can let this happen for 2 days. Let it go for 2 days. Forgive yourself. In every religion, there's a deal there for forgiveness. Forgive yourself and then go back on your program. Go back on that change model to keep it going. Just like you would on cruise control, you would just reconnect with it and let it go. Renew and revisit. Remind yourself always, why did I want to make this change in the first place? I'm hoping today that we'll be talking about some tips, some techniques, and just some ideas that may help you, and also some confirmation of what you've already been trying that has worked. And so when you go back, you say, yes, I do everything she's talking about. Everything. Really, that's amazing. Well, why is it so important? Why would I even choose this as a topic? It restores, repairs, rejuvenates, and revives. Put it in red, because if you take nothing else away from today, know why it's so important to us to get rest. As you get older, you need more or less sleep. Call it out. Oh, this is good. You need the same amount. And how much would that be? 6 to 8. But see, there are reasons why, as we get older, that we just simply do not sleep enough. And the normal range, as I said, is 6 to 8. Now, I've had people come up and say, well, Dr. Udell, I would like to tell you that I have to have 9 hours. I just can't operate unless I have 9 hours, and that's it, and what do you think? And I go, that's fine. If that works for you, we have a litmus test. It's the same thing with people that will say to me, I sleep 5 hours and I'm fine. It's good. Your litmus test is, are you okay the next day? Are you in a better mood? Can you do all of the chores and tasks that you need to do in a normal, comfortable way? Snoring. Now, this is for the bedroom exiles. Have you lived with a bedroom exile? Don't forget, I'm not just talking about man and wife, or man and man, or women and women, or what other combinations could they be? Oh, dogs. I know a man who sleeps with a dog, and the dog snores. And they have to take the dog and put him out of the room. I'm not making this stuff up. Why is snoring a problem? Well, it's really not good for us because it does interrupt our sleep. And also, if you do have a bed partner, it keeps them awake. It's very disruptive. Weight gain. Try losing some weight. That will have a dramatic effect. And I'm only talking about 10%. Why do I pick 10%? Because when you lose 10% of your body weight as you are, you will make significant changes in all of your blood work. That's all it takes is 10%. Would I want you to lose more? Yeah, sure. Go for 10%. It's amazing that a very small change like that will make an enormous difference in your health. Well, here's more serious stuff than sleep and snoring. Would be sleep apnea. It occurs when the air can't make it to the lungs because of some kind of an obstruction. I'm very careful here. That's why some of the weight loss will help you. But also, there are surgical procedures that also can be done. They're very minimal, although I don't think anything surgical is minimal. Forgive me if I have any medical people out there. but they can be done to help with sleep apnea. However, there are other things that can be done, and we'll be talking about them. It is life-threatening. This isn't something you fool around with because it's a strain on all your organs, in particular your heart. And why do I mention the heart in particular? Because when you already have a weakened heart or a diseased heart, or you have already had a heart attack, or you have had some heart history, medical history in your family, you in particular want to pay close attention. Suggestions for better sleep. This is the best part. This is the part I love the best, because I think a lot of us already know how come and why, and we either forget it or we don't want to think about it, or I have this wonderful saying that I'll probably say in 2 more talks, so forgive me. It's when the student is ready, the teacher will appear. And sometimes I'm hoping that some of this is the teacher for you. Warm bath. Forget rope on a soap. Take a bath, rubber ducky, get an adult toy. That would be a little rubber duck. You deserve one. Put that in your tub. Sit down. Play some music. Light some candles. And exercise again. I told you about the endorphins. Those are those hormones that help you relax and calm down. Massage. Isn't that wonderful? Now, I know it's pricey, but you can also teach each other to massage each other. And we're going to do more of that in the chocolate talk. Sleep aids, white noise generator. This is something you can purchase. You plug it in, although I've heard now some come with batteries. They have a rhythmic sound to it. It could be anything, similar to when you buy a CD with water falling or breezes in the trees or chirping. Frankly, if you've been toilet trained by running water, I wouldn't suggest the one with the running water. And there is the circadian rhythms, that internal clock. So get a light box. People that live in countries that do not have a light for long periods of time, it's very dark. I don't want to say England because you'll get mad at me, but I do notice over there it stays dark for a long time. Not so much with the rain, it's just grayer over there. But there are many other countries where this happens. I would suggest getting a light box, and that helps you with that rhythm, and it kind of tricks you. Eye shades, can't live without them. These are sometimes used not to just keep out light, but you can train yourself. When you wake up in the middle of the night and you can't go back to sleep, put on your eye shades. It helps quiet you down and put you back into a signal of, I'm going to sleep now, that's it. Find out what you like. Well, no wonder you have insomnia. You've been lying there all night. I love these people. That's Loretta and Leroy. We will hear more from them later, because I always tell you, through every universal subject I'm going to speak on, you better keep humor in your life. Well, here's some more sleep suggestions. Darkness, cover all the lights. I'm talking about the lights on the floor. I'm talking about the lights from your clock, radio. But Barbara, I have to see what time it is. Why? Why aren't you setting the clock? Well, I get up, I go to the bathroom, I want to come back. I need to know. Why do you need to? Well, I just do. I have to know because you never know. I like to think about it. Yeah, I know. So cover all lights. Aromatherapy, wonderful. There are certain aromas that help relax us. One of them is lavender. You can sprinkle that on your pillow. You can maybe, have a little sniff of it yourself. Upstairs, or is it downstairs, where the spa is, they, I am sure, have different scents that help relax you that they probably use while they're either massaging you or giving you some kind of a treatment. So pay attention to aromatherapy. There was even a part in this book called The Red Tents. Remember that book? Long time ago, where it was during biblical times, and they talked about aromatherapy when women were giving birth, that there were certain aromas that help relax them. Avoid long naps. You want to take a nap? Fine, go take a nap. But what, are you sleeping 2 hours, an hour and a half, and then you complain you can't go to bed at night? No. Limit your nap times. I told you after the age of 50, most men get enlarged prostates. That's okay. Women get a prolapsed bladder. What do you think? We're not going to get something too? And usually we get it either it's aging process or because we've had babies or just because it's a condition that happens. And what happens is that we have to keep running back and forth to the bathroom. But it seems not as bad as men at night. I told you about the cooked tomatoes. Make sure you are eating lots of tomato sauce. There's lycopene in it, and it will help you in terms of keeping some therapy going in a natural way. If not, you better go see a urologist, get checked out, and see what else you can be doing about this. Well, Shakespeare put it really well. Said, innocent sleep, sleep that knits up the raveled sleeve of care, sore labor's bath, balm of hurt minds, great nature's second course, chief nourisher in life's feast. It's not fattening or expensive. Can you imagine? Isn't that great? And it is healthy and it's beneficial. It's almost like jogging. It gives you a cardiovascular workout. And you will hear through all my talks, I still have the same theme, and that's staying healthy, feeling well. And today is not going to be any exception either. So yeah, it's comparable to light jogging. It does increase your cortisol level, and sometimes it can ease the pain of arthritis, helps in people that have allergies, all because of the circulation system, and it stimulates neurotransmitters. Sometimes you can have a sexual encounter, and we're going to talk about all kinds, from holding hands to bim bam, thank you ma'am. But we're going to say that it's very healthy for your heart in particular, helps prevent migraines, and you are less vulnerable to stress. And I know that some of you are sitting there going, yes, but Dr. Udell, I don't have a partner. And I go, it's okay. Because I recall when somebody told me they had their first sexual encounter, they called out their own name. I'm trying to be so delicate here with you. It renews intimacy with somebody that you love and care about, and it certainly is what better way to express your love. Now, I want to let you know that I am talking to all kinds of alternative sexual lifestyles, of which we have in our life. Years ago, it used to be so difficult if someone did have a different way than you did of expressing your sexuality. It was like scary, shameful, frightening. Today, fortunately, it has more or less been accepted. Not everywhere, not all the time, not everybody. But you know what? It's a healthier, better way, and there are different ways. Do I need to go into that more as I shake my head? Because as you can see, I tried to do hair, and as we'll see later in some of the talks, I talk about appearances and what that has to do with your sexuality. Well, you know I'm not going anywhere without putting this into a talk. It is at epidemic levels, sexually transmitted diseases. I won't go into how many there are. Some are very obvious. Some are real sneaky, like for women, chlamydia. You may not even know it until you have a blood test or an exam. And they're like silent, some of these diseases. I would urge you to use whatever protection you can. And I would say this to everyone, and don't tell me, oh, but you don't know, I have a partner, and he, she, them, they, I don't have to worry. You know what? Make sure you take care of yourself. Make the most of your five senses: sight, smell, sound, touch, and taste. Well, the sight. Wear clothes that feel good. They could be velvet, they could be satin, they could be something that also have beautiful color to them. Our body image is important. Be the best that you can be. Look, I tell you who I am, and I tell you I cannot and will not compete with somebody 10, 20, 30, 40, oh, we could go on and on, couldn't we? 50 years younger than I am, but you know what? When I am 80 years old, and it isn't so far away, I promise you, I will be the best 80-year-old you know. Compete with yourself. Be the best that you can be. And do what it takes to get that way. Foreplay, you may ask. Well, Barbara, when do you get into foreplay? This is the thing you do right before you'll want to have somebody respond to you in a sexual, loving manner. Why? Because that's how you get started. When do you do it? Where? And at what point do you do it? And how long is foreplay supposed to last? How long are you supposed to do this stuff? 8 hours before. I know there's a gasp and a I'll tell you why. Foreplay, especially for women, could be at the sink helping wash a dish. Could be somebody handing them a cup of coffee or a cup of tea if they don't feel well. These things, just being loving, being kind, being thoughtful. Got it? It isn't, I could teach you the G-spot, where it is, how to get to it, how to work it. I could teach you different positions. No, that's not what it's about. It is about being able to let someone feel comfortable and loved and that you care about them. All these things are designed for the libido. The libido is your sex drive. It varies as we go through life. Help us all when you're real young and those hormones are running wild. But even as we go through life, they sometimes take over our lives. We do strange, weird, destructive things in our lives because of it. So know that you have 8 hours for foreplay. Any questions? I know this is a shock and talk. Intimacy. No, huh? Fluff up somebody's pillow. How sweet is that? Throw a little cover over them if they're chilly while they're watching TV or something. Give them that hot cup of tea or coffee or cocoa or whatever. Holding hands. I see couples out, they're not even talking to each other. I don't know why they go out to dinner. They ought to stay home and save the money. They just are ordering. They sit there, that's it. You know what? Reach across and hold your partner's hand. Even if you want to do it a little spicy under the table and hold their hand. It's another way of touching each other, of reassuring each other, of letting each other know that you love them, you care about them. On Miami Beach, near where I live, we have people in their 90s. And they're walking down the beach. They're holding each other's hands. Somebody said, yeah, that's because they're taking each other's pulse. Flowers. How many flowers do you have to give someone that shows you love them? How many? One. Now, I said this one time in my men's class. I said, one. And you know what that tells you? And the guy answered back, yeah, that you're cheap. True story. I said, no. He said, yeah, you should be sending a big bouquet, and they like them, and they count the roses, and they tell all their friends. I said, when we get the men and women together, the women will explain to you and tell us women, what does one flower mean? I love you, yeah, and you're special, and you are the one. So let there be spaces in your togetherness. I give you this because of this kind of a talk. It can be threatening, it can be scary, it can be something that you may not have ever discussed in public. But I really believe that part of what I tried to bring you, the humor, the information, again, things that you always knew and maybe forgot about and needed some little nudge, little reminder. But this is what it's really about. Thank you for spending this time with me. Remember, what's important now? You are. Keep the balance.